भाई लोग, डेंटिस्ट्री से मन उठ गया है। डेंटिस्ट्री बड़ा सैचुरेटेड प्रोफेशन है। अब इतनी इनकम नहीं हो पा रही। मैं सोच रहा हूँ डेंटिस्ट्री छोड़ के कुछ और ही अच्छा कर लूँ। पीएन की नौकरी निकली है, उसमें 80,000 की सैलरी है। क्या मैं अप्लाई कर दूं? These are a few of the comments that I come across on social media, especially Facebook, a few of the groups which are in the lighter vein, but they actually are, you can say, the harbingers of taking out your frustration on the internet. Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience practicing in Ludhiana, Punjab. Apart from dentistry, I'm coaching and training colleagues on the topics of practice management, medical legal aspect, consent documentation, and finance in dentistry since the past 10 plus years. So, coming back to the topic, why is there generalized dissatisfaction and unhappiness in dental profession? What are the reasons for that? The reason is or are multiple. Every business model has to adapt in the market situation. Most of the times, our colleagues have 4 common gaps in their business model. Luckily, we are also on the track of following all the business principles. But let me give you 4 common business model gaps which are there, which are one or a combination of them are found in almost every clinic. Some may have 4, some may have 3, some may have 2, some may have 1. But yes, they are there. Number 1, low margins. People who work on lower charges, lower, you can say, lower payments from the patient, they work only for sustenance. And even with a high volume, their profitability is not high. We are, you can say, stuck in that era of advice from our seniors and elders in the family. पहले धीरे धीरे कम रेट रखो, पेशेंट आएंगे, फिर धीरे धीरे रेट बढ़ाना. Like that approach doesn't work anymore. Used to work in the 70s, 80s, or even the 90s, not in this new millennium for sure. So number 1 is low margins. Number 2 are slow payments. Most of the time our margins are good, but the payments don't come through just because we don't detail them. We don't detail our patients. बहुत सारे colleagues, they, you can say, boast on social media, my clinic has 100% advance payments. Practically, this is not possible. Maybe possible in a few clinics, but overall charging 100% pre or say advanced treatment cost is not possible, because many a times we may have to alter the treatment plan in the middle. A core buildup may become a post and core buildup. A middle core suggestion post and core may become a fiber optic fiber post and core. So who pays for that extra, you can say, difference in the cost? So we need to understand that slow payments are one of the reasons where we keep on calling the patient. But then it is our fault only when we don't tell the patient about all those things. So low margins, slow payments. Number 3, inconsistent sales. That is one of the most commonest point. We have healthy margins. Our payments are coming on time, but we can't enjoy the profitability because the wheel needs to be reinvented sometimes. The money needs to be reinvested in the business. आप बोलते जितना आ गया ठीक है, खुश है उसने में, but for survival you have to reinvest some part in the business. You have to induce an element of freshness in your clinic where you don't seem like a, you can say, a stale, giving a stale taste. वही मशीनें 10 साल पहले यहीं पड़ी थी, वही पर्दे, वही blinds. You need to induce an element of freshness in your clinic every 2 to 5 years, depending upon your situation, location, and of course, your affordability. Then, so low margins, slow payments, inconsistent sales. Number 4, no focus on long-term growth, or जिसको हम strategic growth भी बोलते हैं. People are happy in their own cocoon. They believe that yes, okay, जो आ रहा है खुश है, परमात्मा की दया से बहुत खुश है. We don't need to. We don't need to scale. We don't need to build our practice more. The you can say the problem lies here. We just live for sustenance. It is for, especially for those who have a stable income. जैसे अब इतनी इनकम पे क्लिनिक सेट हो गया है, अब मैंने कोई छेड़छाड़ नहीं करनी है. अब मैं छेड़छाड़ करूंगा तो मेरी इनकम डाउन जाएगी. लेट मी गो ऑन टू दैट पार्ट. सो लेट मी एग्जिस्ट विद दैट. So they don't want to move out of the comfort zone. So there are new, you can say, no strategies created to scale the business. Just word to mouth, referral, and or you can say believing in the hand to mouth thing and going with the flow of the survival. So I believe all these four have a capacity to create a financial leakage in your business. So just summing up all those four once again: low margins, low payments, inconsistent sales, and no focus on long-term growth or strategic growth. Thank you so much, guys, for watching this video. If you have liked this video, please do share with your colleagues and friends. And I shall be back soon with another video of mine. Bye-bye. Take care. Shubh Ratri.